Shifting to the healthcare crisis here in Hamilton and across the province. Hamilton Health Sciences says more changes are in the works to help deal with the overwhelming capacity surge at McMaster Children's Hospital. Jason Gaidola joins us live tonight with the latest. Jason.
Taz, Hamilton Health Sciences provided an update this afternoon saying that they will extend care at its children's hospital by adding more beds, and a plan is in the works on possibly transferring teenage patients to adult hospitals. They also said that they met with provincial officials and financial assistance is on the way. Hamilton Health Sciences says surges in pediatric illnesses and staff shortages are the reasons why occupancy is now at 130%. And emergency department wait times are at historic rates at McMaster Children's Hospital.
The daily average of patients presenting at the McMaster Children's Hospital ED as of late has been nearly 200 per day. In our ED, and especially for patients who are requiring admission, they're often waiting well in excess of 24 hours.
Hospital President Bruce Squires says they're working to alleviate overcapacity and surgical backlogs. They say more beds are being added, virtual care appointments will be available if needed, and teenage patients will be moved to other HHS adult hospitals if appropriate.
Now, we certainly recognize that the impact of these very difficult decisions is large and troubling for some patients, parents, and family.
Along with a staff shortage, HHS says minimal supply of children's Tylenol and antibiotics exacerbates strain in the health system. Squires says MacKids has connected with the province for assistance.
The province has flowed $1.3 million prorated to allow us to enable alternative pathways to help to support our emergency department volumes at this difficult time.
Meanwhile, at Queen's Park,
our children's hospitals are overwhelmed. Parents are worried. They're anxious about their sick children.
Today's update comes as Premier Doug Ford and many members of his government are being criticized for not wearing a mask in the legislature, following Ontario's Chief Medical Officer of Health's strong recommendation for every adult to wear one inside public spaces.
Why is the Premier not taking leadership and wearing a mask to protect our children?
The member will know full well that this government has been taking leadership right from the beginning of the pandemic, even in instances where the members opposite refused to work with the government.
Deputy Premier Sylvia Jones was one of the few Ford government officials wearing one.
I think that what we are seeing is people who are making determinations based on their personal circumstances. Personal choice is important here. We should not be passing judgment on people who wear a mask or not wear a mask.
To note, it was Sunday when Premier Doug Ford urged Ontarians to mask up whenever possible. Following this afternoon's update, HHS says it supports Dr. Moore's strong recommendation to mask, and as it was reminding the public that masks are still a must when entering its hospitals.